Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
All right, good evening. This is Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center. We're live for this half hour. We're taking your phone calls. Our topic tonight is hip arthroscopy and ACL injuries. Our toll-free number is 1-888-634-7488. Again, our program is brought to you by Cross Keys Physical Therapy Sports Medicine Center. They're offering free screenings for the next 2 weeks. At the end of the program, we'll give you numbers to take advantage of that free screening offer. They're located, by the way, in Sicklerville, Woodbury, Washington Township, Pennsville, and now open in Vineland and Swedesboro. Again, the toll-free number is 1-888-634-7488. Answering your questions tonight about hip arthroscopy and ACL injuries, we have Dr. John Salvo, who is an orthopedic surgeon and the Assistant Director of Sports Medicine at Cooper Hospital University Medical Center Bone and Joint Institute. They're in Camden, Voorhees, and Newtown Square, Pennsylvania. And next to him is Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy. And congratulations on your opening there in Swedesboro.
Thank you. Thank you.
At the end of the program, we'll have some numbers if you'd like to take advantage of that offer.
Okay.
Long time coming. And we'll begin with you, Dave, with anatomy of the hip and knee joint.
Sure. Well, first we'll start off with the hip. This is the right hip. This is a true ball and socket joint. You can see the socket right here, which is the acetabulum, which is right in here. This is the head of the femur, right here. This is the neck of the femur. This is the greater trochanter. This is the lesser trochanter. And this is the femur. And the femur comes right down from here. This to go down to the knee. This is the femur here. And you come down. This is the patella. This is the tibia. This is the fibula. This is also a right knee. And we go inside here. This is the inferior patella tendon, superior patella tendon. This is the medial collateral ligament. Turn around, this is the lateral collateral ligament. Now we're going to go inside and say, this is the meniscus. This is the lateral meniscus. This is the medial meniscus. And this is the ACL. And you turn it around, get a good shot. This is the PCL. This is the posterior cruciate ligament. There's a brief anatomy of the knee and the hip.
And the hip, and those are the two areas we're going to be discussing tonight, specifically ACL injuries and hip arthroscopy, which people may be familiar with ACL, but this hip arthroscopy, what is that, Dr. John?
Well, it's an arthroscopy is a minimally invasive surgery of any joint, and with much like the more common procedures in the knee and in the shoulder, it can be done now in the hip, and there, with the advent of different equipment and advancing our procedures, we're able to do more inside the hip than we were able to do 5-10 years ago.
What are some injuries that can be helped with this?
There are traumatic injuries and non-traumatic injuries about the hip. Sometimes people can be involved in high trauma injuries such as car accidents, and they can have a hip dislocation and have trouble with cartilage or loose bodies in the hip. And then a hip arthroscopy can be a good procedure to go try to remove those loose bodies. One of the more common ones is a non-traumatic injury where people have a tear in the labrum, which is a soft tissue stabilizer around the hip joint, which can cause a deep, painful clicking inside the hip and can cause mechanical symptoms inside the hip that can be rather debilitating.
Now, Dave, following hip arthroscopy, what type of therapy do you recommend?
Well, I mean, we really like to use, as long as there's no openings or open wounds to the hip, we really like to use the water therapy. We like to take advantage of the buoyancy of the water because we know the hip is a weight-bearing force. So for every 1 pound of body weight is 3 pounds of force on the hip. So we like to take advantage of the water, the buoyancy of the water, to decompress the hip as we can and to get the people back to, usually they have a limitation of range of motion. We're able to work with them a little bit quicker in the water, work on their gait because most of the time they have a gait deviation. So we work on it without any stress being applied to the hip. So most of the patients come in, they're so afraid to put the weight on it because if they have things like a bony fragment or something in the hip, they had a lot of pain. Now they come in, they're a little worried about putting the weight back on it again. Am I going to hurt it again? So we go back to teaching them the proper way of walking again, and they feel comfortable, and then we transform them to land. So we like to start in the water first, and then we quickly move them to land.
Now, Dr. Salvo, you mentioned some of the conditions that hip arthroscopy could be good for. What kind of symptoms would make a person a candidate for hip arthroscopy?
Most people that can benefit from hip arthroscopy have a problem inside the hip joint itself, so it's an intra-articular problem. It can either be a loose piece of cartilage or a loose tear in the, or an unstable tear in the labrum. They will have sharp pain. Usually they feel it not where they can put their finger on it, but they feel it more towards the anterior hip or towards the groin. A lot of times it can be when they're twisting or when they're squatting down and then they go to get up. And some people, if it's a big enough tear, can have frank locking of the hip where the hip gets stuck because of this piece inside this highly constrained joint.
Okay, and if you're experiencing any of these symptoms, why don't you give us a call? We're talking hip arthroscopy, also ACL injuries. Our toll-free numbers, 1-888-634-7488. It's Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. What about arthroscopy, Dr. Salvo? Is this a technically difficult procedure to perform?
In the hip, it actually is. Unlike the more common procedures done in the knee and the knee and the shoulder are relatively easy to get into, and especially the shoulder is a very mobile and loose joint. The hip, as David showed us before on the hip model, is a very highly constrained joint, and it can be difficult to get into, and it's a little technically difficult to move around in there. But as I'd mentioned before, with the advent of some special curved and flexible instruments that we have, it makes these procedures a lot easier to do than they used to be, and we can do a lot more now as well.
All right, to the phone lines, toll free, 1-888-634-7488. We have William from Philadelphia. William, thank you for watching. Thank you for the phone call. Your question tonight on Sports Doctor.
Yeah, I'm 54 years old, and my knees, I have bad knees. I drive a truck. I've been driving it for quite many years, and every time I get into the truck and get out, they feel awful stiff. And I wonder, what can I do? I know you might say I have arthritis.
Okay. Is this indicative of arthritis?
I mean, there could be many things. I mean, really, you need to go see somebody to check it out. But a lot of times when you see people that are very immobilized, and say you sit a lot, I mean, you're not going to really have that much blood supply. I mean, you limit the amount of blood supply going through the joints. You really want to get increased blood supply in there. So I recommend someone like a truck driver, I tell them to try. I mean, it's very hard to do sometimes because the job restraints, but to try to take as many stops as you can and get around and move around as much as you can, and not just to sit in there, because your knees will get stiff. I mean, you don't have really good blood supply down to the lower extremities. You're going to start to have a lot of stiffness going down there. So that could be some of the things. And plus, some people deconditioning. I don't know what your weight is. You might be overweight. You might, because we know your knees is a weight-bearing joint. So if you're also overweight, can be adding to some of the problems you might be having in your knees as well. Could have some arthritis, like they told you. I don't know, John. You want to add some of that?
Just on that initial description you had, it sounds like it probably is the early symptoms of arthritis, just with the stiffness and the achy pain, and like Dave said, being a truck driver in a seated position for a while, that can certainly add to your symptoms as well.
William, thank you for watching. Thank you for the phone call. Let's move on and take another caller. We have Joe on the line from Newark, Delaware. Joe from Newark, Delaware. Welcome to Sports Doctor. Your question tonight.
Yeah, my question is concerning my right knee. I have had, a change in, like, if I walk, it's fine, but I notice that, like, if I bend it sometimes, it'll be a clicking in the right front portion of the knee area.
We have a clicking in the right portion of the knee area, is that?
A lot of times the big thing is whether there is pain or swelling with the clicking. A lot of people get clicking or popping in their knee, and we don't know why it happens. But when we get concerned is if you're having pain associated with it, if you're having swelling associated with it, things like that, especially sharp pain, well, then that's something you want to get checked out and evaluated for. If it's just popping and clicking and it's not really causing pain or swelling, then that might just be something you have to live with.
And of course, Newark, Delaware, not too far from the Pennsville location of Cross Keys Physical Therapy Sports Medicine Center, who are offering free screenings, by the way, for the next 2 weeks. So maybe you want to take advantage of that offer. We'll give you numbers for that at the end of the program. Our toll-free number right now is 1-888-634-7488. We're talking hip arthroscopy and ACL injuries. And I believe our next caller is Tom from Norristown. Tom, are you there? Tom from Morristown, welcome to Sports
Yeah, I
Talk.
am here.
Hi, what can we do for you tonight?
Yes, I am. How you doing today?
Good.
What's your question, Tom?
Actually, I have a torn ACL and a torn meniscus, and I got an MRI done about 2 years ago, and I just keep hearing horror stories about an ACL injury and the operation. So I just wanted to see what you guys think about that.
How old are you, Tom?
I'm 33 years old.
Okay. With ACL injuries like David going through with the anatomy, the ACL is actually the main stabilizer inside your knee for any pivoting or twisting activities. And it does take a good amount of trauma in order to tear your ACL. After your ACL is torn, your next backup stabilizer is your meniscus. Now, at 33 years old, with a tear in your ACL and then a tear in your backup stabilizer, your meniscus, that's a knee that needs some help, especially at your age. If you were mid-50s or 60, you may be able to get away without doing anything. But at your age, you got a lot of time left on this knee, and you may want to think again about getting evaluated and getting something done for that knee.
I really don't know what you're hearing, but the results with these ACLs nowadays are tremendous. I mean, haven't really seen any major problems with these ACLs being done nowadays.
You know, the recovery time is so much different than it was 10 years ago, and everybody's certainly different. But the outcomes of this kind of surgery really are excellent now.
There was that defensive back not that long ago for Pittsburgh that was actually able to have the ACL surgery and then actually played later in the season. Right. So,
and well, I think I'm hearing John's concerns, and I follow with him. With a guy that's 33 years old, having an ACL that's damaged and a meniscus that's damaged like that, your activity levels. I mean, he actually can cause more damage to his knee if he doesn't get it corrected by doing twisting activities, jumping activities, and stuff like that. That he'll be in worse shape if he doesn't have it done than if he tries to go without it.
Which is probably why the meniscus had a problem.
Right.
Correct.
Right.
Our toll-free number is 1-888-634-7488. Our next caller is from Stratford. I didn't get the caller's name. It's Mitch. Mitch, welcome to Sports Doctor. Your question tonight for our guest.
Hey, guys. How you doing tonight?
Good.
I don't really have a question. I just want to comment. I have a vascular necrosis, and I end up acquiring it from taking prednisone from poison ivy. I don't know if you guys ever heard of anything like that, but it's more common than what you would think, and I just wanted the listeners to know about that. If you don't need to take any prednisone, please do yourself a favor. Don't take it. I've had 2 operations, decompression, grafting. Now I'm looking at total hip replacement. It's been a nightmare. So if you don't need to take prednisone, don't take it. Thank you.
Thank you for that.
Thank you for that
service announcement.
Yes.
Our toll-free number is 1-888-634-7488. You're watching Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. Let's grab another caller from Blackwood this time. Is the caller there? Anthony, welcome to Sports Doctor. What can we do for you tonight, Anthony?
I had a ACL reconstruction back in the late 80s. Now they gave me a choice of using a cadaver's ligament or taking one of my hamstrings and pulling it through the knee. I just noticed in the last 6 or 7 years I have a lot of instability in it. Not really pain, but if I try to run or it goes out on me a lot. I'm wondering if that's because of the hamstring that they use.
Well, actually, both grafts, there are really 3 graft types. There is the allograft, which is from cadaver tissue or from another person, and then autograft, or your own tissue, which can either be the patellar tendon, which is the center part of the tendon, if we want to look on the model. It's the center part of this tendon right in here. Usually you take the center third of that, or the hamstrings, as you had done, which are three muscles that come around the inside part of the knee, and you take two of them and wrap them over each other and make an ACL. All these grafts really usually work pretty well. Any looseness later, especially you're talking about 15 years later, giving way, that could be due to something else inside the knee. It could be due to your graft being a little loose, but usually it's not due to the graft choice itself, because all the grafts usually work pretty well.
It could be also just from just losing some of his musculature, not really continuing to work your quads and your hamstrings. You need to be able to continue to work these stabilizers of your knee because they really help to support your knee. And if you don't do those, you're putting a lot more stress on the internal structures of your knee that can't handle all that. So I think that maybe it might be just a factor that you might need to get back to doing some strengthening exercises again. So you might be a perfect person to take advantage of that free screening that we have. So maybe we could review some of these things and to see if you do have an instability again. And if you do, we'll recommend you to go back to see your surgeon again. And if you don't, maybe it's just a matter of we just show you some of these exercises again to get you jump started to doing that.
And Anthony, stay with us, because at the end of the program, we'll give you numbers to schedule an appointment to take advantage of that free screening offer. In fact, during the course of the show, you may see the numbers up on your screen. Our toll-free number to reach us with questions live tonight on Sports Doctor is 1-888-634-7488. We have Andy on the line from Wilmington, Delaware. Andy, you're on Sports Doctor. What's your question tonight?
Yes, sir. I know you guys are talking about, I just wanted to know if I had a couple back surgeries, and
Well, we lost him.
Oh well.
He said, maybe he didn't fall hurt his back again.
maybe he'll call back again. The toll-free number is 1-888-634-7488. We're talking hip arthroscopy and ACL injuries, and I think we wanted to get to this. Someone called about arthritis in the knee.
Yeah.
What about hip arthroscopy for arthritis?
That's really not, that's not one of the things that we do arthroscopy for, because in the hip it's a highly constrained joint, and arthritis in any joint is going to really cause a little stiffening of that joint. And if it's already hard enough to get in there and do work, you can actually do, you can potentially do more damage than good getting in there for arthritis. There are certainly people that are going in and trying to do some things to clean out a joint, but it's kind of, the jury's still out on that one for arthritis for the hip.
Okay, back to the phone lines. Toll free 1-888-634-7488. Down the shore, Beasley's Point, we have Kevin on the line. Kevin, go right ahead with your question on Sports Doctor.
Yes, sir. I was playing some soccer with a mate of mine, Travis, and what happened was I tore my meniscus and my cartilage. So since then, I've had arthroscopic surgery. Okay, now I've had that about 8 weeks ago, and at this point now, I have bone on bone on my right knee, and simply before I could run, jog, and walk upstairs and so forth. Now, because the meniscus isn't there, the cartilage isn't there anymore, I'm at a standstill. And I was curious if there is ways to get me back to jogging. Is there any ways that they can? Is there a substitute cartilage they've created this day and age, or is anything of that sort?
The substitute cartilages or the cartilage transplant surgeries really are more for localized defects on your cartilage surfaces on weight-bearing joints. From your brief description, it sounds like yours is probably more global through at least one of the three compartments of the knee. That is a tougher area, and we have not tackled that yet. If you have a focal defect in there, there are things we can do with transferring cartilage and bone from another part of the knee, or actually taking your normal cartilage cells and growing them, and then a second surgery a few months later to transplant them in. But when you have complete wear down and you're bone on bone, there's not a lot to do other than, when it's bad enough, joint replacement surgery, which it sounds like you're still far away from.
All right, Kevin, thank you for watching. Thank you for the phone call. Again, the toll-free number is 1-888-634-7488. Let's talk to Larry in Philly. Larry, go right ahead with your question on Sports Doctor.
Yes, I'm a 24-year-old male, and the question, I just torn my ACL.
Okay.
I just recently had surgery. And my question is my knee ever going to be back to 100%?
100%. Has that ever happened?
100%? Well, hopefully.
That's up to you.
That's up to you. I mean, there are so many. The surgery really, truly is about 50% of the battle. So, once you get through that hour procedure, you've only gone through 50% of it, because the rehab is so important. I'm going to let Dave talk about the rehab, because that's really what reconditions you. We can structurally make your ACL, put a new one in, make your knee strong, make it stable. but it's really getting it moving and getting it strong that's the important part. And then
I think it's so true. I think some of these people, they go through some of these surgeries, they expect it to be back 100% in 3 or 4 months, and it's just not happening. And some of it has to do with conditioning. I mean, really, what kind of shape you are prior to having the surgery makes a big deal of it. I mean, you got to have good blood supply, healthy soft tissue, good muscle tone, and I think that's real important. Even after surgery, I talk to people all the time about that. You need to continue to do your exercises. So it's really going to be how hard you work in your rehab is how quickly you're going to get better, and how consistent you are of maintaining your musculature around the knee joint, because they do their part and take care of the ACL. That gives you your main stabilizer and gives you support. And then you need to take the stress off that by continuing to strengthen the musculature around the knee to take the stress off the internal structures of the knee. Because we want the muscles to absorb the stress on the knee and not the ligaments or tendons. So it's really ultimately up to you, and it really usually takes at least a year to be back to 100%.
All right, Larry, keep working, all right? You're watching Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. We're taking a break. We're coming back with more of your phone calls. Toll-free number is 1-888-634-7488. Stay with us.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy. Washington Township, Cyclical, Pennsville, Woodbury.
You're watching Sports Doctor. We're here every other Thursday night at 9 o'clock. Our toll-free number is 1-888-634-7488. Tonight we're talking hip arthroscopy and ACL injuries. We have Dr. John Salvo with us, an orthopedic surgeon with Cooper Hospital University Medical Center Bone and Joint Institute, and also Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy. On the line with us, we have Andrew from Lansdale, Pennsylvania. Andrew, go right ahead with your question.
Yeah, my father has some arthritis and he's got some cartilage damage, and somebody told him about this oath procedure. I was wondering how, what the successful rate is, and what do you do for that for physical therapy? Thank you.
Well, why don't I tell you what the procedure is, and then let Dave talk about the therapy. The Oates procedure is a couple calls back. We had a question about the cartilage, and basically what that is osteochondral autograft transplant system. So everybody's got that. Basically, you take a big dowel or a small dowel of bone and cartilage from another spot in the knee, and you take it and fill in where the cartilage defect is. Again, if it's an isolated area in a weight-bearing surface of the knee, it can help a lot with the symptoms. But if it's a global arthritic problem, it's not going to help, and it's not going to be as successful. But if it's a localized lesion, it can really help a lot.
As far as rehab goes, as the doctor nicely explained, it really depends on where it's at, because we know obviously the knee is a weight-bearing force, so really weight-bearing depends on the communication between the doctor and the therapist. They let us know how much they think that the patient can handle. Most of the time it's toe touch for the first couple of weeks, and then we start working on range of motion right away, and then we start working on some stability exercises following that. And obviously it's always going to be to, once again, as how severe and how severe your tear was and how much they need to put in there.
Andrew, thank you for watching. Thank you for the phone call. You can call us too. Our toll-free number is 1-888-634-7488. You're watching Sports Doctor. Bob is our next caller. He's from Marlton. Bob, welcome to Sports Doctor. Your question tonight?
Hi, I'm a 45-year-old male. I had 3 ACL repairs and replacements. Is it time, the arthritis is so bad, is it time just to have it replaced completely?
Is the ACL with the surgery all in the same knee?
All in the same knee.
Okay. It's got 3 surgeries.
So you've had 3 ACL surgeries, and what's your question? To have the knee replaced?
The arthritis is so bad in the knee, and it hurts so, it's consistently sore.
Right.
Is it time to get it replaced?
That really is a question that I can't answer right now, because it depends on how bad your x-rays are and how bad your arthritis is. Certainly in your mid-40s, that's a very, very young age to have a joint replacement because they don't last forever. And the younger you are, the more active you are, and the more weight you're carrying, the less time the joint replacement is going to last. So you try to wait as long as possible, but again, you don't want your patients to be miserable either. I would definitely discuss that with your surgeon and get some other opinions as well, and put everything together and go with what you think is best.
I think that's a very good point. I think, and one of the big thing that he just said to me is about weight. I mean, that might be something you might look at right there. I don't know how, if you're overweight or not overweight. You might. Some people think they're not, but they might be. Losing weight really makes a big part on your knee joint because it takes the stress off your joints. Because your body, like I said, your knee is your shock absorber of your knee, just like your car is your shock absorber of your vehicle. You really need to. The more weight you lose, the less stress is going to be on that. So if you're trying to prolong something like that, try to lose a little bit of weight and try to get onto a real good strengthening program to try to stabilize that knee as much as you possibly can to try to prolong it because you really are too young to have that done.
Okay, I think we got time for one more caller. It's Beverly in Coatesville. Beverly, go right ahead with your question.
Yes, my question is, I've been having pain around my groin area, or I can't tell if it's my hip on the left side. It's when I'm sitting, if I go to get up, I have a real bad pain. Or sometime if I'm sitting upright, I have to lean back because the pain is really big.
Okay. I don't know if we have time to answer that. We probably don't. We're going to have Beverly hang on the line, I think, and we'll talk to her after the program. I want to give our viewers the numbers for Cross Keys Physical Therapy. We're talking about the free screening offer. All you need to do is schedule an appointment. You can do so in Sicklerville by calling 856-728-1900. Washington Township is 856-374-3707. Woodbury, 856-853-0988. Pennsville, 856-678-8000. Their new location in Vineland, 856-794-8300. And in Swedesboro, it is 856-467-9911. I want to thank Dr. John Salvo for joining us. He's the Assistant Director of Sports Medicine, Cooper Hospital University Medical Center, Bone and Joint Institute. They're located in Camden, Voorhees, and Newtown Square, Pennsylvania. Also, Dave Anselmo, as always, from Cross Keys Physical Therapy Sports Medicine Center. Thank you for joining us as well. We'll be back 2 weeks from tonight with more of Sports Doctor. Until then, I'm Joe Chapana. Stay well.